These are the 7 nursing specialties that pay 6 figures, while most nurses struggle to break 90,000. The difference between a staff nurse making 75,000 and a CRNA making over 200,000 isn't talent or luck. It's strategic career planning. Let me show you exactly which nursing paths lead to the highest salaries and what it really takes to get there. At the top of the nursing salary pyramid sits the certified registered nurse anesthetist. CRNAs earn between $203,000 and $215,000 annually, and the top 10% make over $250,000. Even entry-level CRNAs start at $170,000 to $180,000. Think about that. A new graduate CRNA makes more than most nurses will ever see in their entire careers. But here's what most people don't tell you about becoming a CRNA. You need a BSN, which takes 4 years. Then you need at least 1 to 2 years of ICU experience, and not just any ICU experience. They want to see you managing ventilators, running continuous drips, caring for the sickest patients. After that, you're looking at another 3 to 4 years for your DNP or master's program. That's 8 to 10 years total before you can practice. And by 2025, all CRNA programs must be doctoral level. No more shortcuts. Here's an interesting fact. CRNAs are the sole anesthesia providers in approximately 2/3 of rural hospitals. In many parts of America, if you need surgery, a CRNA is putting you under, not an anesthesiologist. They administer anesthesia for 850 to 1,000 procedures annually, which works out to roughly 4 procedures every single working day. The second highest paying specialty is nurse practitioner, with average salaries ranging from $121,000 to $130,000. But that's just the average. Psychiatric NPs earn between $135,000 and $150,000, while acute care NPs make $125,000 to $140,000. What really impacts NP salaries is practice authority. In the 24 states where NPs can practice independently, they earn 10 to 15% more. Why? Because they can bill insurance directly, open their own practices, and aren't required to have physician oversight. The path to becoming an NP is shorter than CRNA. You need your BSN, which is 4 years. Most programs recommend 1 to 2 years of RN experience, though it's not always required. Then add 2 to 4 years for your MSN or DNP. Total timeline comes to 6 to 8 years. Now here's where it gets interesting. The third highest paying specialty surprises most nurses, and that's nurse informatics specialist. These nurses earn $98,000 to $115,000 on average. Senior positions pay $130,000 to $150,000. Add certifications from organizations like HIMSS, and you're looking at another 10 to 15% salary bump. Nurse informaticists bridge the gap between clinical practice and technology. They design electronic health record systems, analyze healthcare data, and ensure technology actually helps rather than hinders patient care. With AI integration expanding rapidly in healthcare, this field is exploding. The education path requires a BSN, about 2 years of clinical experience to understand workflow, and typically a master's in informatics, which is another 2 years. 8 years total, similar to CRNA but with very different day-to-day work. Fourth on our list is the clinical nurse specialist. CNSs earn $85,000 to $95,000 on average, but specialized areas push that to $100,000 to $115,000. Metropolitan areas pay 15 to 20% more. CNSs are the Swiss Army knives of nursing. They provide direct patient care, educate staff, develop policies, and conduct research. They're experts in specific patient populations, maybe cardiac patients, maybe oncology, maybe pediatrics. They see the big picture of patient care and work to improve outcomes across entire units or hospitals. Coming in fifth, Certified nurse midwives earn 115 to 125,000 annually. Those in private practice clear 130,000, while hospital-based CNMs make 110 to 120,000. Here's what's fascinating about nurse midwifery. It wasn't until 1997 that CNMs could get direct reimbursement from Medicare. Before that, they had to work under physicians just to get paid. Now they deliver bobbies, provide prenatal care, gynecological exams, and even primary care for women throughout their lifespan. The sixth highest paying specialty might surprise you because it doesn't require additional clinical training, and that's nurse manager or administrator. These roles pay 90 to 110,000 at the manager level. Directors earn 120 to 150,000. And if you make it to chief nursing officer, you're looking at 175 to 250,000. But here's the reality of nursing administration. You're no longer at the bedside. You're dealing with budgets, staffing ratios, patient satisfaction scores, and endless meetings. Some nurses thrive in this environment. Others feel like they've lost their nursing identity. Male nurses, who make up only 12% of all nurses, comprise 41% of nurse administrators. Make of that what you will. Our seventh specialty, nurse educator, has the lowest salary on this list, which is 77 to 85,000 on average. University professors make 90 to 110,000, while clinical educators earn 85 to 95,000. Why would anyone choose the lowest paying advanced role? Because nurse educators shape the future of nursing. Every nurse you've ever worked with learned from a nurse educator. Without them, the profession dies. Let's talk about the elephant in the room, which is the investment required for these salaries. That CRNA making 200,000. They probably have 80 to 100,000 in student loans. They spent nearly a decade in school and training. They work in high-stress environments where one mistake could kill someone. The NP seeing patients independently. They're carrying their own malpractice insurance, managing complex chronic diseases, and in many states, still fighting for the right to practice to their full scope. Geographic location changes everything. West Coast and Northeast salaries run 20 to 30% higher than the South or Midwest, but cost of living often eats that difference. A CRNA in San Francisco might make 250,000 but spend 4,000 monthly on a one-bedroom apartment. Rural areas flip the script. They often pay 20 to 30% above urban rates because they're desperate for providers. That rural CRNA might only make 190,000, but they're buying a four-bedroom house for what urban nurses pay in rent. Here's something else to consider, and that's the controversies surrounding these roles. There are ongoing turf wars between CRNAs and anesthesiologists over who should provide anesthesia. Some physicians groups actively lobby against independent practice for NPs. The DNP requirement for advanced practice remains hotly debated, and the question is, does it improve patient care or just add debt? The workforce shortages tell the real story. We're projected to be short 12,000 CRNAs by 2025. NP demand is growing 45% through 2032. These aren't just numbers, they represent patients who won't get care. So what does this mean for you? If you're a bedside nurse feeling stuck at 75,000, you have options, but each path demands sacrifice. More school, more debt, more responsibility, different types of stress. The question isn't which specialty pays the most. It's which specialty aligns with your skills, interests, and life goals. That CRNA salary looks great until you realize you'll be on call every third weekend. The NP autonomy sounds perfect until you're managing 40 patients a day in primary care. Here's my advice after looking at all this data. First, shadow someone in the role you're considering, not for a day but for a week. See the reality beyond the salary. Second, calculate the true ROI. Include lost wages while in school, student loans, and how long until you break even. That 8-year CRNA path means 8 years of opportunity cost. Third, consider where you want to live. Full practice authority states offer NPs more money and autonomy. Rural areas pay premiums for most specialties. Some states have better nurse-to-patient ratios, making the work more manageable. Finally, remember why you became a nurse. If it was purely for money, you picked the wrong profession. These high-paying specialties come with high demands. Make sure you're chasing a career you actually want, not just a paycheck. The 7 specialties we've covered, CRNA, NP, Informatics, Clinical Nurse Specialist, Nurse Midwife, Administrator, and Educator, each offer paths to 6-figure salaries. But they also offer something more important, the chance to impact healthcare in meaningful ways. Whether you're putting patients to sleep for life-saving surgery, diagnosing and treating complex conditions, designing better healthcare systems, or teaching the next generation, these roles matter. The nurses making the highest salaries aren't just collecting paychecks. They're taking on the responsibilities that come with advanced practice. They're the ones making critical decisions when physicians aren't available. They're leading healthcare into the future. So yes, you can make $200,000 as a nurse, but the real question is, are you ready for what that salary represents?